So if a patient goes to you and they're either wearing a denture or all of their teeth have to be removed, what are their options when it comes to dental implants in your practice?
In our practice, you can get a full denture, upper and lower, which is not going to be your best option. It comes out, nothing holds it in, and really it's just like a hood ornament. It's just for looks.
Okay.
So the next option is having two implants, and your denture snaps into those. Not the best option also.
Why?
Because you are still going to be able to snap it out, and there's a lot of maintenance underneath it, and things wear down, it rocks in the back a bit. The best option is to have more implants and have things secured in. They don't come out.
Okay.
A more permanent option.
Now, you're doing these things guided, right? I mean,
Yes.
these surgeries.
Absolutely.
Like on the computer.
Totally computer. We have a 3D technology. Things are 3D printed. Guides are fabricated so that we can put the implants in the best spot for your bone and the best spot for you cosmetically, so that we're doing a lot of pre-planning to give you the best result at the end.
So no more traditional dentures. They're out.
No, traditional dentures, especially on the top, you're not going to be able to taste your food as well. The whole roof of your mouth is covered. With the permanent solution that doesn't come out, you get that whole roof of your mouth where the taste buds are free and clear, so that you can enjoy your foods more.
So you could eat whatever you want with these things.
Yeah.
Like how soon can you eat after the procedure?
As soon as things are screwed in and secure, you can eat a meal whenever you're ready.
And what about pain? Because I know you're big on sedation in your practice.
Sure, yeah.
But pain is not something they really complain about?
No, because you're sedated, you're comfortable. Listen, you're having surgery, so a little discomfort, but our patients don't complain about it. They're so excited for their beautiful teeth, it seems inconsequential.